I'm Joni Zehm-Steffens, certified menopause provider and women's sexual medicine specialist. I began my career at CentraCare as a labor and delivery nurse and later became one of the first nurse midwives. I have always loved sharing experiences with my patients. And as I got older, I realized that finding health care that met my needs in my 40s and 50s was challenging. So I shifted my focus to menopause. Menopause is not a single moment. It is an evolution. As early as the late 30s, menstrual cycles become irregular, unfamiliar symptoms show up, and our bodies feel like a stranger. And despite the inevitability of menopause, many women are unprepared and are caught off guard. Menopause naturally occurs when the ovaries stop producing adequate amounts of estrogen and progesterone. That period leading up to the final menstrual cycle is called perimenopause, and it can span 8 years. And for some women, that's the most difficult part of the transition. Your experience is real, and it can be hard. There are estrogen receptors everywhere in the body, so it makes sense that any body system can be affected. Hot flashes, night sweats, sleep disturbances, brain fog, and mood changes are common. Other connections with menopause, like the onset of muscle and joint symptoms, are harder to recognize. And some menopause symptoms are more silent, like the loss of lean muscle and bone density. The menopause transition is also correlated with increasing risks of chronic health conditions: cardiovascular disease, diabetes, osteoporosis, dementia, and cancer. So it's really important that you have all the tools you need to manage your symptoms and optimize your health as you age. In my menopause practice, I primarily see symptomatic women over the age of 40. One of the primary strategies that I use is menopause hormone therapy, or MHT. MHT is effective at reducing many symptoms and minimizing health impacts. The ideal MHT patient is healthy, 45 to 60, or within 10 years of menopause. MHT is safe and effective for many women, yet only a small percentage of treatment candidates are offered the option of MHT. Women are seeking reliable sources of information, and if that's not made available, they are vulnerable to misinformation and a profit-driven industry. The Menopause Society is an excellent resource of consumer education. You don't have to do this alone. There are evidence-based guidelines for treatment options. Let's have a conversation. I'll be your detective, your advocate, and your support. We aren't 23 anymore, but this is not our first rodeo. And we are smart and strong and capable of taking charge of our health.